If you have mild peripheral arterial disease, you may be recommended to start a medication regimen, start an exercise regimen, and then undergo those lifestyle changes that we talked about related to stopping smoking, healthy eating, and being more active. If you have more severe peripheral arterial disease, what we'll talk about are those options that relate to medication and/or if you need to consider invasive type of procedures such as a stent or a widening of the arteries that go to your lower extremities down to something like a lower extremity bypass. There are pros and cons to all of them, and part of it really depends on your goals and objectives for meeting your health needs and also how severe your PAD is. It's very important when we're talking with patients with PAD to understand what is of high value to them. There may be a gentleman who wants to be able to walk down the aisle with his daughter, or there may be someone who wants to be able to take a long vacation that involves hiking or walking for extended periods of time. What is of value to each individual is very important to take into consideration as part of that shared decision making that will derive their care plan. So when we're talking with patients who've been diagnosed with PAD about the different treatment options, we try and make sure that they understand the whole scope of the options and then give them an opportunity to weigh in on what their preferences may be. No two patients with PAD are the same, and it's very important to understand both what the individual's current health conditions are, the severity of their PAD, and then as part of our shared decision-making process, understand their goals, their health goals and preferences so that we can come up with a care plan that's unique to that individual. There's no one therapy that is going to be the same for every single person with PAD. One of the best things you can do prior to that first visit or prior to the visit when you're going to be discussing your treatment options is to do your homework. It's okay to make a list of questions, and it may be something that you sit down with your spouse or family member so that you're all understanding what PAD means and what your treatment options are. It may be that we start with a non-invasive care plan, but depending on how your disease progresses, you may actually need to have a more invasive decision made later in the course of your disease. But if you manage this as if it's a chronic disease and it is something you have to manage over the lifetime, our goal is to keep you healthy and to keep from having your disease progress to the point where you do need more intervention in the future.